A few weeks ago, I had a patient named Mr. Sanderson. He's 74, sharp as a tack, still runs a small antique shop downtown. But lately, he said conversations had started to blur. It's like people are mumbling, he told me, like I'm underwater and just nodding along. He assumed it was age until he tried something that changed everything in less than a week. And that's the story we're opening with today because millions of seniors are living in that same muffled world. And what they've been told is just aging might actually be fixable in days. I'm Dr. David Chen, and today we're unpacking one of the most overlooked causes of hearing decline after 60 and the simple science-backed solution that could help restore clarity faster than you think. Before we dive in, I need you to do something important. Drop a comment below telling me your age and whether you've noticed any hearing changes. Are conversations harder to follow? Do you find yourself asking people to repeat themselves? Your experience matters, and it helps this community understand they're not alone. And please hit that subscribe button and turn on notifications because I share critical health strategies like this every week to help you stay sharp, independent, and connected to the people you love. Now let's take a closer look at what's really happening, because understanding this will show you exactly why this one habit is so critical. Think of your blood circulation like a highway system. When it runs smoothly, oxygen and nutrients reach every cell and you feel energized and strong. But when circulation declines, the early signs are easy to miss. And that's the danger. Poor circulation happens when blood flow becomes sluggish or blocked, especially in your feet and legs. The causes include plaque buildup in arteries, weakened vein valves, high blood pressure, diabetes, lack of movement, or simply aging. What makes this dangerous is how quietly it develops. Swollen ankles, cold toes, minor discomfort. People brush these off as normal aging, but these are serious signals your body is sending you. When blood vessels lose flexibility, the risk of clots increases dramatically. Without proper blood flow, your body can't flush out toxins leading to inflammation, infections, and faster aging. Professor Dr. Joel Kessler, a leading expert in regenerative medicine, puts it clearly. Blood flow is essential to every aspect of healing and vitality. Without circulation, nothing functions properly. The good news is, when caught early, poor circulation can often be managed or even reversed with simple daily changes and targeted nutrition. And that's exactly what I'm going to show you today. So let me walk you through the warning signs that appear in a clear pattern, each one more serious than the last. If you recognize yourself in these symptoms, pay close attention because the habit I'm about to reveal addresses every single one of these issues. Warning sign number 1, changes in skin color. Have you noticed your feet or ankles looking pale, bluish, or marked with dark patches? This isn't cosmetic. It's a sign of poor oxygen delivery. When blood isn't flowing properly to your extremities, your skin literally changes color because it's starving for oxygen. These areas often feel cold to the touch and heal slowly when injured, opening the door to infections. This is your body's way of telling you that blood isn't reaching where it needs to go. Warning sign number 2, cramps when walking or at night. A sudden sharp cramp in your legs while walking that forces you to stop could indicate intermittent claudication, which is a lack of oxygen in your leg muscles from narrowed arteries. You might think it's just a muscle issue, but it's actually your arteries struggling to deliver enough blood. Nighttime cramps are even more telling. They disrupt your sleep and signal the same underlying problem. Your muscles are literally crying out for more oxygen-rich blood, and when they don't get it, they cramp up painfully. Warning sign number 3, frequent tingling and numbness. That pins and needles sensation in your feet, especially after sitting or standing for a while. Most people think this is just from poor posture or sitting too long. But when this becomes regular, it points to nerve stress from insufficient blood flow. Your nerves need constant blood supply to function properly, and when they don't get it, you feel that tingling and numbness. Over time, this leads to peripheral nerve damage, affecting your reflexes and balance. This is serious because it increases your fall risk dramatically. Warning sign number 4, Cold feet even on warm days. If your feet feel icy when the weather's warm, blood isn't reaching your extremities properly. This happens when vessels are narrowed or blocked, preventing oxygen-rich blood from reaching your toes. I've had patients tell me their feet feel like ice blocks even in summer, and they're wearing socks to bed. This isn't just discomfort. It indicates arterial problems and weakens your feet's natural defenses against injury and infection. And warning sign number 5, the most visible varicose and spider veins. Bulging, twisted veins, often bluish or dark, are one of the clearest signs of poor circulation. These form when valves inside veins weaken, allowing blood to pool in your lower limbs. This causes discomfort, swelling, and that heavy feeling in your legs by the end of the day. Spider veins, those tiny red or purple lines that look like a web, are also warning signs of compromised vein health. Professor Kessler warns that the biggest mistake is thinking these signs are purely cosmetic. Poor venous flow is like a silent unraveling. When it fails completely, complications are far harder to treat. If you're experiencing multiple symptoms, I strongly encourage you to consult a specialist. A simple vascular ultrasound can identify issues before they become dangerous. But now, let me tell you about the one habit that addresses all of these problems. And if you're finding this helpful so far, go ahead and hit that like button. It really supports the channel and helps us reach more seniors who need this information. The one daily habit that restores hearing clarity after 60 is something so simple, so overlooked, that when I first tell patients about it, they look at me skeptically. But the science behind it is rock solid, and the results speak for themselves. I'm talking about a specific ear activation ritual that takes just 3 minutes each morning. Now, you might be wondering why everyone talks about hearing aids and cochlear implants, but not this habit. Here's the truth. While hearing aids amplify sound, they don't address the root cause of age-related hearing loss. What many people don't realize is that hearing decline after 60 isn't just about the ears themselves. It's about blood flow to the inner ear, inflammation in the auditory system, and the health of the tiny hair cells that convert sound into nerve signals. Let me explain exactly how this works. When you perform this ear activation ritual, it triggers a process called cochlear microcirculation. This means your blood vessels literally widen and relax, allowing more oxygen and nutrients to reach your inner ear. Think about trying to water your garden with a kinked hose versus a fully open hose. That's the difference this ritual makes in your auditory system. This expansion allows more oxygen and nutrients to reach your tissues, easing common symptoms like ear fatigue, that muffled feeling, and difficulty understanding speech in noisy environments. Within weeks of doing this ritual correctly, many people notice their hearing symptoms improving dramatically. But this ritual doesn't stop there. It also helps reduce inflammation at the cellular level, protects your blood vessels, and slows down the tissue breakdown that comes with aging. As we get older, our cells become less efficient at repairing damage on their own. That is why regularly performing this ear activation ritual is so valuable. It supports your body's natural defense systems and helps your auditory tissues function properly for longer. But there is more. The specific movements in this ritual also help protect your brain and your balance system. Hearing loss is one of the major drivers behind memory decline and balance problems with age. When your ears can't process sound clearly, your brain has to work much harder to decode what people are saying. This extra cognitive load has been linked in studies to increased risk of dementia. Not because of hearing loss itself, but because of what it forces the brain to do. Guess, fill in the blanks. Work harder for every sentence. Studies have shown that people with adequate hearing function have significantly better memory, lower rates of falls, and fewer symptoms of social isolation. One study found that seniors who improved their hearing through proper ear care experienced a 40% reduction in feelings of loneliness and depression within just 8 weeks. Another study showed improved walking distance and reduced dizziness in patients with balance issues. This isn't just theory, it's backed by solid science. Now, here's the critical point. All of these benefits depend entirely on how you perform this ritual. A rushed or incorrect approach won't give you the results you're looking for. When you do it properly, it becomes much more than just an exercise. It becomes a protective practice that helps slow cellular aging, supports your organs over the long term, and reduces the damage that builds up in your body year after year. So where do you start? The ritual has 3 key components. First, you begin with jaw movements, opening and closing your mouth in slow, controlled motion while gently massaging just below the ears. This stimulates the temporomandibular joint and increases lymphatic flow around the auditory canal. That's right by the Eustachian tube. And when you engage that area while breathing deeply, in through the nose, out through pursed lips, it signals the vagus nerve to shift into parasympathetic mode. That alone helps reduce inflammation in the auditory system. Then we move to light fingertip tapping along the mastoid bone, that ridge just behind your ears. This sends gentle pulses that stimulate local blood vessels. It's like you're knocking on the door, telling the system to wake up. And then we finish with what I call the neural loop, placing 2 fingers at the base of the skull, gently pressing and holding while rotating the neck side to side. This re-engages the cervical nerves that support balance and auditory processing. Most people report a deep calm and a sense of opening in the ears right after. And the beauty of this ritual is that it's not trying to force change. It's inviting the system to remember how to function. You're not fixing the ear. You're restoring its environment, circulation, pressure balance, and nerve readiness. When done daily, this sends consistent signals to the body. This area matters. Keep supporting it. In studies conducted in Japan, seniors who practiced this for 3 minutes a day reported better clarity in conversation, fewer episodes of dizziness, and even better sleep. Why sleep? Because inner ear stability directly affects the nervous system's sense of safety, and when the brain feels stable, it stops staying on high alert. That improves everything from hearing to mood. One of my patients, 79 years old, told me, "Doc, I didn't just hear better. I felt less anxious in crowds." That's the spillover effect of better auditory processing. You stop feeling overwhelmed, and we often forget that the ears aren't just sound sensors. They're part of the balance and orientation system. When they function better, your entire brain works less hard just to stay upright and make sense of the world. Let me give you a practical example of how to do this. For the jaw movements, sit comfortably in a chair with your feet flat on the floor. Open your mouth slowly, as wide as comfortable, then close it gently. Do this 10 times while placing your fingertips just below your earlobes and massaging in small circles. You should feel a slight stretch in your jaw muscles. This is good. It means you're activating the right area. While you do this, breathe deeply. In through your nose for 4 counts, out through your mouth for 6 counts. This breathing pattern activates your parasympathetic nervous system, which reduces stress and inflammation. Next, for the mastoid tapping, use your index and middle fingers. Find the bony ridge just behind your ear. It's about 1 inch behind your earlobe. Tap gently but firmly, about once per second, for 30 seconds on each side. You're not trying to hurt yourself. You're just creating a gentle vibration that stimulates blood flow to the inner ear. Many people tell me they can actually feel a warmth spreading through their ears after doing this. That's increased circulation. Finally, for the neural loop, place 2 fingers at the base of your skull, right where your neck meets your head. Press gently and hold for 5 seconds. Then, while maintaining that pressure, slowly turn your head to the right as far as comfortable. Hold for 5 seconds. Return to center. Then turn to the left. Hold for 5 seconds. Return to center. Repeat this sequence 3 times. This movement helps reset the connection between your neck nerves and your auditory system. The entire ritual takes about 3 minutes. That's it. 3 minutes every morning, ideally right after you wake up. Your body is most receptive to these signals in the morning, when your nervous system is transitioning from sleep to wakefulness. If you can do it near a window where you get natural morning light, even better. That light actually regulates melatonin, which influences fluid pressure in the ears. Now, I want to share another patient story because it illustrates just how powerful this simple habit can be. Her name was Sarah, and she was 67. She came to me complaining about constant ringing in her ears, a condition called tinnitus, and difficulty hearing her grandchildren when they visited. She said it was breaking her heart because she felt disconnected from her family. She'd tried hearing aids, but they made everything too loud and uncomfortable. She was frustrated and losing hope. I taught Sarah this exact ritual. She was skeptical at first. She said, "Dr. Chen, how can moving my jaw and tapping my ears possibly help?" But she agreed to try it for 2 weeks. Just 2 weeks, every single morning. After the first week, she called me. She said the ringing in her ears had quieted down. Not gone completely, but noticeably softer. After 2 weeks, she came back to my office with tears in her eyes. She said, "I had dinner with my family last night, and I heard my granddaughter tell me she loves me without asking her to repeat it. I haven't been able to do that in 2 years." Sarah continued the ritual every day. 3 months later, her hearing had improved so much that she no longer felt isolated in group conversations. She told me, "This 3-minute habit gave me my life back. I can engage with people again. I don't feel left out anymore." That's the power of addressing the root cause, instead of just masking symptoms. Now let's talk about what you should expect when you start this ritual. In the first few days, you might not notice dramatic changes. That's normal. Your body is adjusting. You're waking up systems that have been dormant or struggling for years. But pay attention to subtle shifts. Do sounds seem slightly clearer? Does your balance feel a bit more stable? Do you feel less tension in your jaw and neck? These are all signs that the ritual is working. By the end of the first week, many people report that the muffled feeling in their ears has decreased. Conversations in quiet environments become easier to follow. By the end of the second week, you might notice improvements in noisy environments. Restaurants, family gatherings, places where background noise used to make it impossible to hear. By the end of the first month, the changes can be quite significant. Better word recognition, less ear fatigue, improved balance, and often, better sleep quality. But here's the key: consistency. You have to do this every single day. Missing days here and there won't give you the results you're looking for. Think of it like brushing your teeth. You wouldn't skip brushing for a week and expect your teeth to stay healthy. The same principle applies here. Your auditory system needs daily support to maintain and improve function. Now, I want to address a common concern. What if you have severe hearing loss or a diagnosed condition like Ménière's disease or acoustic neuroma? Should you still do this ritual? The answer is yes, but with a caveat. This ritual is not a replacement for medical treatment. If you have a serious underlying condition, you need to work with your doctor. But this ritual can be a complementary practice that supports your overall ear health and may improve your quality of life even if it doesn't fully restore your hearing. I've had patients with moderate to severe hearing loss who still benefited from this ritual. They reported less dizziness, better balance, reduced tinnitus, and improved ability to use their hearing aids effectively. One patient told me that after doing the ritual for a month, his hearing aids didn't need to be set as high because his natural hearing had improved just enough to make a difference. Before we wrap up, I want to give you one more piece of advice. Combine this ritual with good overall circulation habits. Stay hydrated. Drink plenty of water throughout the day because dehydration thickens your blood and reduces circulation to all parts of your body, including your ears. Eat foods rich in omega-3 fatty acids like salmon, walnuts, and flax seeds. These healthy fats reduce inflammation and support blood vessel health. Avoid excessive salt, which can increase fluid retention and pressure in the inner ear. And stay active. Even gentle walking improves overall circulation, which benefits your ears. If you've made it this far, I want to thank you. Your time is valuable, and the fact that you've spent these moments learning about your hearing means you're already ahead of the curve. If this video gave you hope or a new tool you hadn't thought of before, I invite you to like this video, share it with a friend, and comment below. Even if it's just one sentence about what you're going to try. And if this kind of content speaks to you, I'd love to have you as part of this community. Subscribe and stay tuned. We're just getting started. Your hearing still has so much potential. You just need to give it a chance to show you what it can do. Remember, this isn't about perfection. It's about progress. 3 minutes a day. That's all it takes. 3 minutes to potentially restore clarity, reconnect with loved ones, and reclaim the confidence that comes with being able to hear the world around you clearly. Thank you for watching. I'm Dr. David Chen, and I'll see you in the next video. Stay connected, stay engaged, and take care of those ears.